Often we'll get them to come in and have a seat with us, and we'll ask them a few questions. So there are some important questions that we need to know. So when the date of their last menstrual cycle, if they still have them. Some people are on contraceptives, so maybe don't have them, but that's absolutely fine. We then want to know if they're on any contraceptives, because the hormones in those can impact the test. We'll ask them whether they've had any pain or discomfort during intercourse or after intercourse, whether they've had any bleeding in between their menstrual cycles. And then, I'm trying to think what else we would ask them. Oh, whether they've had cervical cytology in the past, whether they've had any positive test results in the past from this, and those sort of things. Then I would explain to them that they're going to undress from their waist down. I quite often point out they can leave the socks on because it can be quite cold in these rooms, so you leave your socks on, undress from the waist down. I quite often give them a chair and say, you can put all your stuff on there, because I think sometimes you don't know where to put your things, do you? So I quite often have a chair and say, that's your chair, pop your stuff on there, have a lie down for me, and I normally have a bit of paper that they can cover themselves over. So I would explain to them that they're going to undress from the waist down, pop your stuff on the chair, have a lie down and cover yourself over, and call me when you're ready. And then when I'll go in, I'll ask them to bring their heels up to their bottom and legs out, so we can sort of start the test. So we're about to insert the speculum, so I'm just going to insert the speculum now. We insert it sideways, and then we turn, and then we open it up. Okay. So what you can see down here now is the cervix. Okay. And you can see there's a little hole there in the cervix, and that's called the os, or it's the opening to the cervix. And that's where we're taking our swab from. Okay. So we'll then just pop the swab down, turn it a few times at the opening, take the swab out, and then as soon as I've taken the swab, I will remove the speculum. Okay, and I'll just ask the individual to stay there for a moment just while I put my swab away so we don't kick everything over, but I like to get the speculum out straight away because it's not very comfortable. Okay, and that's the end of the procedure. So it's I say a swab, but it's like a little brush. Okay, so it's a long thin stick basically with like a little it is a plastic brush, which sounds really awful, but it's actually softer than it sounds. Okay, and it's just got basically that's all I can really describe it as, is a little brush, and we're just sweeping it round the cervix. I think quite often what people find uncomfortable is actually the speculum. So when the speculum goes in, we open it up. If it sort of jolts, I think sometimes that can actually dig into you. It's not to say the brush isn't uncomfortable. It's not something you'd queue up for and pay to have done. But actually, I think it's more the speculum and the discomfort of that, if I'm honest with you. We normally have 20 minutes for the full appointment. So that includes getting the person in, asking them the questions, them getting undressed, having the procedure, getting dressed again, coming and sitting down, and then having us explain when they'll get the results and things. So the actual procedure itself, minutes. The only thing it can take longer sometimes if we can't find someone's cervix, which sounds a bit odd, like it would be there, but some people have a retroverted womb, so actually your womb sort of tilts forward, but some people have it the other way, and in that case we might need to ask them to sort of put their hands under their bottom and lift up a little bit, or give us a good cough sometimes so we can get it into view. So that doesn't happen very often. I've done loads of these, and I think I've only struggled once or twice to get, and then that's a little bit longer, but still only probably 5 minutes. I think if I was struggling to find someone's cervix beyond a couple of minutes, I would stop. I've had patients come and have an appointment with me beforehand, just to get used to me, get used to the room, when there's been a real fear there, and just to sort of, we've gone through, we've looked at the speculum sizes, we've shown them the equipment, all that sort of stuff. We'll go out of our way to settle you and make you feel comfortable. The other thing is that it is so important, and quite often these horror stories you hear are exaggerated. So having the speculum inserted isn't that uncomfortable. When we open it up, that can feel a little bit odd. If you relax, it's absolutely fine. Having the swab done doesn't actually really hurt when you're having it done, but afterwards it can feel like the first days of your period, you know, those sort of crampy pains that you get, but nothing worse than that. So the only thing I would say is that if someone's having a really, really bad reaction to it and feeling really uncomfortable, it's possible that they have very difficult periods. And, you know, potentially does that person have endometriosis? Do we need to be considering that? Because actually for most people, it's a mild discomfort, bit of a tummy ache, like you would do with your period, and it goes within a day or so. So you'll go for your test, you'll have your test done, and then what we'll explain to you is that you should receive a letter in the next couple of weeks with your results. Now, most people will receive a results letter that say, everything was normal, absolutely no problems, we'll see you again in 3 years' time. Now, some people will receive a letter that says that they have seen these sort of cell changes, and they'll be invited to colposcopy. Now, people really panic at this point thinking, I've got cancer. Now, no, you haven't. It's very unlikely that you have. But what they've seen is they've seen cell changes and they want to look at that in more detail. So that would be a visit to the hospital. It's an outpatient unit, and you go along and it's not dissimilar. You'll have a speculum inserted and I'll have a look, but instead they'll look through a really, really strong microscope, and they'll put a little clear liquid on the cervix that turns those cells white, and they can see them really clearly in the microscope. They'll probably take some more swabs for testing, and more often than not, they'll say, right, we'll see you again in a year's time. And when you go back in a year's time, it's all cleared up, okay? If it hasn't, they'll test again. And sometimes people who maybe at more advanced stages will need some sort of procedure. They might need a LETS procedure, like I said, where they'll burn those cells away to get rid of them, to stop them sitting there mutating. But again, not to say it doesn't happen to people who regularly go for cervical screening, but it tends to be people who haven't been for cervical screening for a long time.